The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right. Hi, everyone. We have another guest here today. So would you be able to just introduce yourself for us and tell us a little bit about your journey so far in dentistry?
Hi, everyone. Yes, this is Sara Ehsani. I'm a board-certified pediatric dentist. I graduated dental school actually back home in Iran and then also here in America. So I did dental school back home. I'm from Iran, and I graduated in 2012. And then I moved to America because I wanted better opportunities for myself and I wanted to grow. And I saw America as a great land of opportunities. So I moved to America and I had to do my 2 years advanced standing program. So then I can get the DDS license here. So I got that from UCLA and I graduated in 2016. And then after that, I specialized in pediatric dentistry and I graduated from practicing. So it's been 5.5 years that I've been practicing in North Texas, Dallas area. And yes, I mean, beyond clinical patient care, I also love to do volunteer work, organize dentistry, research, and education.
Awesome. I'm excited to dive into some of those things. So first, with starting as a pediatric dentist, how did you decide you wanted to specialize in pediatrics?
Yes, absolutely. So that's where all the fun is, right? Because, you know, kids are interesting. So they can bite you, scream at you all day, spit on you, throw up on you. So who doesn't want that life, right? But anyways, it's aside from that, because those are the things that you're going to see in pediatric dentistry. But I love it. It's just, I feel like for me, it's about establishing the correct habits from early on in life, because you see them from when they're like 6 months old or even sometimes younger. And then you just educate the parent and then the patient, and you basically make that connection throughout life. And I love it. It's rewarding. It could be very challenging at times, but it is very rewarding. Of course, I didn't know that I always wanted to do kids. I decided to do that after my pediatric rotation in school. So I really liked it. And then I started digging into it more. And then I was like, that's what I want to do.
And you talked about kids a bit. I feel like pediatric dentistry kind of gets thrown in with working with patients with special healthcare needs. Is that something that you also do in your practice, or is it primarily actually the pediatric patients?
Yes, of course. Special care, of course, yes. So basically, when you do your residency in pediatric dentistry, you learn a lot about patients with special needs. I see a lot of kids with autism, of course. You don't see, a lot of time you don't see as like complicated cases as you see during your residency in the hospital, but it's still, I would say autism is a big one. And then you see a lot of, like you can see patients with syndromes, and I do that too. I feel very comfortable treating them. Sometimes, like if I need to refer them, if they can be really sick, I refer that too. But yes, that's what I do as well.
And we connected through Instagram, so I love seeing everything you're doing outside of work as well, traveling and everything. So when it comes to work-life balance, what advice do you have for people?
Okay, so work-life balance, is that even a thing? Like, does that even exist? I wonder. Or it's just a myth, I wonder. Because, you know, like balance could, like everyone can define balance, definitely. But I feel like for me, like balance is basically like setting boundaries, prioritizing self-care, allocating time for like friends, family, my hobbies that I want to do, and then definitely relaxing and sleep. But I would say like one piece of advice that I have is basically have clear boundaries between work and personal life, because work is always there, like it doesn't go away. So there's always work, but you need to always prioritize yourself, and then you need to make sure that you have time for activities, for the things that you want to do, And then for me, a big thing is definitely learning to say no, because I had to learn that, like how to say no, because I always like wanted to do more, and I felt like I wanted. So especially I feel like because I was as an immigrant, then you want to fit in. So like you want to fit in, and then you want to try to do all these things, but there is so much that you can do. They're like basically opportunities are like endless. So there's always an opportunity. There's always something you can do more. But I feel like at the end of the day, you need to know that these are my boundaries, and then you need to prioritize. So this is something that I learned too, that I always have to prioritize like the things that I really want to do, and the things that are okay, like optional, maybe if I do them are okay, if not, okay. But so because otherwise you have this massive to-do list, and then you just get overwhelmed, and then you can easily get a burnout. And then you just want to prioritize, say, okay, so these are the main things that I want to do, so let's work on those first. And then for me, it's always by deadline. So usually I'm like, oh, so this one, the deadline is approaching, so let me do this first, let me do that first. And then when I have a list, I try to do the easier ones first. So then I feel accomplished when I do them. I'm like, oh, yes, these are, like the smaller tasks or the easier ones. So I write them down, I prioritize them, and then I go based on my list. And then I always I would say reward myself for when I do something. I'm like, yes, I did it. Or if I do 2 out of 3, then I'm like, I'm very happy that I did it. And I reward myself with something. And I try not to put too many tasks, because otherwise you can put too many tasks for yourself, and then you're like, oh my god, easily overwhelmed, because it's easy to get overwhelmed, and it's easy to overthink as well, but you don't want to overthink. That's why you need to learn to say no when it's necessary. And I would say that at the end of the day, more things, they don't give you peace. Sometimes less things give you peace, because at the end of the day, you want to be at peace. So that's something that I would say. And the other thing that is very important is to manage stress and also time effectively, because there's always stress. So it's not like, oh, if I do this, I'll get less stress, or if I work towards this, then I'll be at peace. No, stress is always there. There's always a stress in life, but you just need to know how to manage it better, and you just need to know prioritize basically. And I would say just do less, try to do a little bit less, and less at a time, but not in general, because sometimes you don't want to do less, but just everything all at once, which that can help with preventing burnout. I feel like stress also, because sometimes what happens is that we think that we're going to do a lot of things, and then we don't want anyone else to help us, because as dentists, we all have OCD, and and then we just want to take care of everything ourselves. But that's why you have a team, so then you can trust them, and then you can actually delegate tasks to them, and you stop overcommitting yourself, because that always ends in burnout. So I would say assign roles to people whenever you can. If you are an associate or if you're an owner doctor, either way, you have a team. So then I would say just try to trust the team, and then just be a good leader and assign tasks, and then ask them to deliver the task. So then basically you just set the timeline and the deadline, and then trust people to do the process. Because at the end of the day, you just need more peace, I would say, than anything else. And you want to have less things to worry about. And that's why this would be very important. And then self-care. Self-care is very important. So don't forget that if you need to, so whatever self-care is for you, just try to do that. So if it's exercise, meditation, sometimes it's spending quality time with friends, traveling. I would say for me, traveling is a big thing, but not everyone, of course, is a fan of traveling. It can actually overwhelm a lot of people. But for me, that's a big thing. I love traveling, and then I would say, learning about different cultures, new cultures, getting to see the world. And then I'm out of my bubble and I know, oh, wow, like you only live once. And it's not about, okay, that like project that I need to finish, or like that patient that I need to see, or that one bad review that I got. No, it's all about, it's you only live once and you try your best. And you just need to focus on the good things, on the positive things, on all the 5-star reviews that you have, not that one review, or I would say all the things that you really want in life and that you're trying very hard for it, and what you've become, and all that accomplishments that you have done. So you need to focus on those positive things. So self-care is very important. I remember that I used to like listen to podcasts, and I was like, oh, I need to listen to all these like different podcasts because I want to learn more. So whenever I was driving to work or like even exercising, I'm like, oh, I need to learn this and I need to know this. So I need to do audiobooks and then podcasts. But then at some point I was like, but I just want to like listen to music, I want to listen to music, or sometimes I just want to dance. And it's okay not to learn something new, it's okay. It's just, if music puts me at peace and at ease, that's what I want to do. So self-care is very important. And then I would say it's very individual to each person, because it's like you make those intentional choices to support your overall health and happiness. And that's like just different for everyone.
Raise your hand if you've been putting off getting disability insurance. Jim Kachmar from Doctors Disability Specialists can help educate you about your options. I have personally worked with Jim to ensure that my strategy is appropriate for me. He took the time to explain key terms and make me feel really good about my decision. If I were to describe Jim in a few words, I would use knowledgeable, kind, and collaborative. Jim can be reached via email at james.kachmar@ddsteam.net, or you can call him at 207-671-2216. His website is www.ddsteam.net/team/Jim-Kachmar. Reach out for a no-obligation complimentary consultation today. No compensation was paid to this client for their testimonial. Their experience may not represent the experience of others nor predict future results. Thank you again to Doctors Disability Specialists for working with me on this episode. And when it comes to you talking about boundaries and like not overcommitting yourself and learning to say no, that's something I'm looking ahead to as I start working as a dentist. And organized dentistry, I know you're a fan of and you're involved in. So for me, I'm very passionate about that as well, but it's tricky to know like how many committees can you join, how involved can you get when it comes to organized dentistry. So can you tell us a little bit about your involvement in organized dentistry and how you kind of pick and choose when it's a good time for you to get involved in something?
Yes, absolutely. So yes, I'm very involved in organized dentistry, and so I was like, even in dental school, I was very involved, and then after that in residency, and then right now I'm involved too. I feel like it's really good to get to know people through organized dentistry, and then just like find what you really want to do, because it could be different topics, different purposes, and different committees and councils. But if you do like all of them, then like you can get overwhelmed, and then you can't do, because it's like all of them basically, if you volunteer in something, you need to do something, and then multitasking actually doesn't work. So if you can't be like perfect at multitasking. So if you do multitasking, then you just can't deliver, and like all of those committees where you want to do like a few of them or some of them, and then just be good at it. But as you said, the opportunities are endless. So for me, I would say I really like the local organizations, but I mean, I like the national levels too, but that's like a different commitment. But from local, you get to know a lot of people, and then national, I feel like you see what we do as a whole as dentists, and it's just like it's very eye-opening because, like, for example, I'm involved in American Dental Association Council on Dental Benefit Programs, and I'm on the code maintenance committee. So that one is like basically active in evaluating and voting on CDT code, or like dental codes. And I had no idea like how, like, like this, how important and like complicated at the same time this can be, until I got involved in it. I'm like, wow, there's like so much into this and so much behind this, and we have no idea. Because when you work as a dentist, like, you don't know like what exactly is behind all of those like codes that you build. And then when you like vote on them and like all those like changes, and then you can see it, and then you're like, wow, you're making a difference. And so it depends what you like to do, because some people like to do more legislative stuff, and then they want to be more like in the, I would say, like legislative action, like depends like what you're, because there's a committee or like council for anything basically. So that's good. And then also there's like local level, and there's the state level, and then there is basically the national level. So then you can see, like, if you want to, usually like people start from, that's what I did too, from the local level and then state, and then you do the national after that, if you see that you like it, or this is something that you like. Because you can always like start small, and then if you want, you can expand on it. And then you can always, like, if this is something that you don't like, you can always say no. You're like, oh, I don't think this is working for me, and I don't think I have a passion in this. So I think, like there are some, basically, I would say, instances that, people told me to, let's do this, or why don't you do that? And I'm like, no, but I don't think, like I can, or if I do it, I'm not going to do it as effective, because I'm involved in other things too. So I don't want to be a chair of like something else while I'm doing another thing for another organization, because it could be too much, and you don't want to overwhelm yourself. Because like many emails at the same time. So you need to make sure that you're like on top of it, and then you have a schedule for yourself too, and then you have a system in place. So you have a system in place that, for example, like at this time, I'm going to answer the emails, and I'm going to do this. And I try not to work on the weekends unless like I'm in a meeting or something, but I try not to do that, because I want to have my weekends for myself. And that's very important for self-care. So I would say just have a system in place, and then see, yes, it's good to be involved, but maybe you want to start small, and then like you want to do something bigger. But first start with where your passion is, and then what you really, really want to do. And then don't forget that that's the goal, because sometimes like someone can offer you something else, and then you're like, oh, let me take it. But no, learn to say no. If your goal is something else, just focus on the goal.
That's good advice, because it's easy to get distracted with, oh, that could be cool. That could be cool too. But you have to first figure out what you want and why you want it, and then only take steps focused on that, because it can be easy to get sidetracked, like you're saying.
Yes, exactly. And I would say always know what commitment you need to have, because if you don't know, you're like, oh, yes, I'm going to do that. And then you see it's a lot of commitment. And then you also don't want to fail, right? You're like, oh, no, I need to, like, I already accepted this position, so I want to do it, and I want to be like the best, but sometimes if you can't, you can. At the end of the day, it's your mental health, and that's the most important thing, and that's more important than anything else. And I would say always embrace failure as a learning opportunity. So even if it doesn't work, even if you don't like it, but then you learn something, and then you make connections that are going to be valuable in your life.
And that kind of leads nicely into the last thing I wanted to ask you about. So, if there's any people trying to get into dental school right now, or dental students looking ahead into working, and they just have a lot of fear of failure, fear that they won't be good enough, what's some advice that you have for them?
So I would say acknowledge and embrace the fear, because it's normal to feel anxious. It's normal to be scared. Like, nobody knows when you choose a profession, a new profession, you don't know what's the end of it. But remember that you have a goal, and this is a learning process. and the challenges are going to be there. And no, life is never easy. There are always challenges. And then you just need to view those challenges as opportunities that can actually help you grow, instead of obstacles, I would say. And believe in yourself, because it's going to take time to succeed in something, and just see the people around you that they succeeded and they did the same, and then you can do it too. So if you believe in yourself and your strengths, that's always going to overcome that fear. And always have a mentor and support system, because this is important. If you have a good support system, then you know who to go to for guidance, or if you have any issues and you need any advice, then you have the right community next to you. So that is really good, to have a mentor and support system. Just a mindset that basically this is going to be the opportunity for me to get to what I want, and then to enhance my skills, then that always like helps you move on. And as I said, like failure, it could be a learning opportunity. So don't worry about failure. I mean, people always make mistakes and they fail, and that makes them become the person that they are right now. I mean, I've definitely had a lot of failures myself, but you just learn from it, and then you move on, and then that makes you who you are. And always celebrate the achievements. So even small fears, but if you overcome that, I would say always like celebrate it and accomplish it along the way, and then motivate yourself. At the end of the day, dental school is not easy. Of course, it's hard, but if that's your passion, if that's what you want, if that's where you see yourself, then you can always overcome any challenges that you have on the way. And then you can, with dedication and persistence, because those are very important. If you have dedication and persistence, then you can overcome anything. But it's normal to have doubts and fears, and I would just acknowledge it and embrace it, and just learn on the way and learn to grow.
You've given a lot of awesome motivation and kind of strategies for people for time management and setting boundaries and taking care of themselves. So if people want to connect with you and follow you, where can they do that?
So my Instagram, it's Sara, Saraedds. So they can always, if they have any questions, they can always reach out to me, and I'd be happy to help, and I'd be happy to share my knowledge and support in any way that I can.
Thank you so much. I appreciate it.
Thank you, and best wishes on your path ahead.
Thanks.
I know it's not an